lovelies, and welcome to today's video. My name's Alya and I'm so glad you stopped by. Today we're talking about blood in the eye. Why is it there and what does it mean? Hope you enjoyed today's video and you stick around to learn all about why there might be blood in your eye. It's most certainly a scary thing when you get a photo taken of the back of your eye and you're told that there is blood in there. It must be horrible to hear that you have a hemorrhage or a bruise inside your eye. But even more scary is when you wake up in the morning, or you're just going about your day and you happen to notice in the mirror that your eye is red and bloody. So these are really scary things that can happen, and I'm here to explain to you how they happen and why it might or might not be a serious thing at all. So only yesterday I had a patient come in and she had hemorrhages before in her retina, and we put it down to the fact that she had a really strong cough. So sometimes when you're having a bout of a strong cough, like a bronchitis type cough, or if you have, for example, been vomiting for some reason, so anything that can really shake your head up, maybe you've been in a car accident and had a bit of sort of whiplash or something, these things can cause some movement inside your eye of the jelly. It causes like a ripple effect. And sometimes, even though we don't really see much jelly movement on the scans necessarily, we do see the remnants of that movement. And that could be like a little pinch, a little hemorrhage usually in the visible part of the scan. And these things normally need close monitoring, but they do resolve on their own. They very rarely need to be lasered or anything like that. Obviously, more severe cases where it's a retinal tear or it's a vitreal hemorrhage where it's gone and bled out into the retina a bit stronger, you want to clean that up with some drugs or some laser. But these things are probably less likely to happen, whereas these little random flare-ups of I call them little bruises, they're actually quite often visible on the scans. So a lot of times we think the patient might be diabetic, or they might be on blood thinners, or they might have some sort of cause for this bleeding, but more often than not it's just something that happened. And that gets me to the next one, that when we have a bloodshot eye. Now, anyone, absolutely anyone, young, old, sick, healthy, cough, no cough, blood thinners, no blood thinners, whatever it is, can definitely have a bloodshot eye. So normal. More often than not, in my experience, it comes on with some dry eye. So basically the eye just, is under a little bit of extra pressure because it's dry. So there's a little bit more friction going on, and the little blood vessels, they definitely need the eye to self-lubricate, so the tear film to be really good in order to do its job. So think about it like grinding gears in some sort of machinery. If you don't oil those gears properly, they're going to wear down, they're going to get damaged, they're going to get scratched up. The same sort of thing happens in dry eye. You definitely want your eye to be lubricated all the time. Now again, for most of us that usually means just having a rest and blinking, or staying hydrated or whatever, but every so often we do need assistance, and that comes in the form of eye drops. Now the best kind of eye drops are the preservative-free kind, definitely, because especially if you're going to be using them for a period of time, I would not be putting preservatives in my eye if I can avoid it. Especially nowadays where preservative-free drops are so easy. They come in different kinds of packaging, they're so accessible, and if you look at the cost benefit, it's actually it's not more expensive. It looks more expensive when you're buying them because they cost more to buy, but they last a lot longer. So you always have them there should you ever have another episode of dry eye. Inside the eye, the other place that can often get a little sort of surprise hemorrhage that we always start to question is the optic nerve. Sometimes, again, on photography, you would never feel it, you would never get any symptoms, but you would just find it randomly on eye examination or eye photography. It's a little disc hemorrhage, we call them. So that's a little hemorrhage that comes up right on your optic nerve area. Difficult thing about that one is that it actually could be a sign of glaucoma. So that one really requires a lot of monitoring, because we need to then go and investigate whether it's been caused by the actual nerve becoming thinner and therefore having some hemorrhaging, or whether it's being caused by something else, like that first example of the jelly just moving, or the head being shaken for some reason, or like a severe cough or illness. A lot of the time, no matter the cause, these things do resolve on their own. That hemorrhage isn't going to stay there forever, thank goodness. But it is something that needs regular monitoring. You definitely don't want to let these things keep occurring and not being looked at. The reason for that is there is an underlying more severe cause for these things that perhaps initially isn't obvious. You want to keep coming back and checking and checking and checking, because until you find the root cause for, especially if they're coming up again and again and again, you're going to have a potential situation where you've missed something, especially when it comes to glaucoma, or even when it's just a bit of jelly movement. So jelly movement or vitreal detachment is very, very benign. It usually doesn't do anything to us. It just happens. Most of us don't even know what's happening. A lot of the time, by the time we as clinicians find out that it's happened, it's been and gone. So, you know, it's something that a lot of the time goes undetected, and that's fine. However, occasionally this is the first sign that something bigger is coming. So if there is a little bit of hemorrhage on photography, I always urge that there is a vast retinal exam. So all the peripheral areas are checked, and checked again potentially sort of 6 months later, not too much longer later. The reason for that is that if there is sort of precursors or warnings for a posterior vitreal detachment, so where the jelly comes off completely, and in that process there might be tears, that is something you want a doctor looking at regularly, because you will very rarely get a chance to catch damage happening to your eye. The eye is very basic when it comes to its symptoms, unfortunately, or maybe fortunately, depends how you look at it. We don't get much warning when it comes to things happening internally. The eye does not feel pain internally. It doesn't feel anything internally. It's just a big old receiver. So it's a very organized, a very complicated, a very amazing, high metabolic receiver. Never sleeps, always works, but it doesn't give you pain signals. So there's no way for the eye to communicate with you that something's going wrong. So a lot of the time these things are just routinely picked up, routinely monitored, and routinely caught, fixed, and then it's never a problem again. So there's no really cause for panic or concern, but you know, if that jelly was to move away and cause a tear or cause a bigger secondary bleed, for example, this is something we need to at least educate and warn the patients about, and then come back and check. If it is going to go and cause a tear, usually these tears happen peripherally. Tears can often sit there for months, even years, without then becoming full-blown retinal detachments or retinal tears. But there's no guarantee. You can have minutes or you can have years, and there is absolutely zero guarantee of which one you're going to get. So sometimes, you know, your retina has a little bleed, then several months later has a slightly bigger bleed or a bit of fluid, and then, you know, within a matter of time, the whole thing's coming down. That's, of course, worst case scenario. In other instances, we accidentally find what looks like a really old tear, but it's very slowly and steadily gaining fluid around it. In which case, again, you still want to treat it as though it's an active tear, because you don't know at which point the retina's not going to have enough integrity to stay up there. If you think of the retina like a giant meshwork of integrated and interrelated and intermeshed cells, you sort of start to picture this idea of like a bit of a sponge. If you tear up a sponge, all those little connections come away at different rates, and some connections are thicker and tighter, and some connections are looser and have bigger gaps. That's kind of how I imagine the retina as well, especially when it comes to retinal tears. You'd never know what that connection at that point, what that relationship between cells really is. So what starts off as just this innocent little, you know, hemorrhage, little bruise, can sometimes be a precursor of something much bigger and much more dangerous. So, you know, the right thing for your doctor or optometrist to do is to really monitor it for you. It doesn't have to be overzealous or anything, but just at least, you know, enough to make sure that nothing bad is happening inside the eye and that you're just safe. You know, that the eye is not going to have any major consequences or will need, you know, a big old surgery. The biggest concept of all these things, aside from the fact that we're trying to make sure that the eye is not going to undergo further damage, you know, or have any kind of sight loss, the biggest sort of motivator for all of this is that we're just practicing prevention versus cure, because cures are never going to be 100% perfect. Prevention is way, way, way more effective. Why do I say that? Well, because imagine having to sew a little hole in a pair of pants as opposed to having to completely redo a whole leg. Most people, when given the choice, will always say, of course, give me a little patch job that will very likely hold for a very long time, if not the rest of my life, versus walking around with the constant idea at the back of your head that any day, any moment, things could get very serious very quickly and you could find yourself in emergency. So that's what, as clinicians, we always are trying to avoid for our patients. But if you do see your bloodshot eye in the morning and you get really, really frightened that the eye's really red and full of blood, please don't be. Little hemorrhages happen all the time. We call them subconjunctival hemorrhages because that's what they are. They sit between the conjunctiva and the episclera, which is sort of the very top part of that white bit of our eye. We don't know it, but we've got a clear sheath that sits on top of our eye. And that clear sheath is there to protect us, to produce tears, to keep everything in status quo, to keep everything normal and balanced and good. And sometimes when those little vessels are irritated, like I mentioned before, little bits of sort of little vessels pop open and they just leak out into that space. That's okay. They will heal. It'll be fine. It's actually not that much blood at all. It's just that it's in a really, really icky spot. Because it's on the eye and because that space is so tiny, that incy-wincy bit of blood fills it really dramatically and fully. And that's why it looks so bad. But honestly, it's not much. If that same bleeding happened on your fingernail or on your arm or whatever, you would think it a paper cut. It's really nothing. But it just looks really dramatic because of where it is and the space in which it's sitting. So it's literally sitting between two planes and spreading really nicely, like topping on a cake or something like that. I don't know. Jelly in a donut, just filling out. So really nothing to worry about. Okay, my lovelies, I hope that today's video was really interesting and you really enjoyed today's topic. And I hope that you're staying safe and happy out there and getting back to some kind of normal wherever you are. For more videos like today, make sure you subscribe and stay tuned for more now Tuesday uploads. I'm really excited about this new upload day. I am excited that it might reach a new audience and that things will stay exciting and new and I can continue to keep up all of information that I have been so far. For more things about my whole world, please jump onto Instagram. Definitely more stuff going on there. Tell me what you think down in the comments. If you've got any questions about eyes or you'd like to hear about a topic or a query that you've been concerned with, please do shoot me a message down there or on Instagram and I'm more than happy to address it in a future video. Wherever you are around the world, lovelies, I hope that you're having a wonderful day and I can't wait to see you on the next one. Bye. Spit bubbles gather.